The advent of potent antiretroviral therapy in 1996 led to a revolution in the care of patients living with HIV and AIDS. Although treatment is not cure and also present new challenges with respect to side effects, adherence and drug resistance, they have dramatically improved the quality of life of persons living with HIV and AIDS, as well as reduced the rates of mortality and morbidity associated with the disease. The success achieved over the years in providing comprehensive HIV treatment services in our major towns and cities are the core in the quest for increased access to treatment, care and support services for persons infected and affected by HIV. Recognizing this need, the Department of International Development provided the Family Health International funding through the Ghana AIDS Commission to embark on a project to engage private self-financing health facilities in the central and western regions of Ghana in a bid to scale up treatment services in a unique public-private partnership approach. Family Health International, an organization committed to improving lives worldwide through research, education, and services in family health, works in close collaboration with the Ghana AIDS Commission, the National AIDS Control Program, as well as regional and district health authorities. The project employs strategic behavioral change communication to increase demand for HIV treatment services. Resources and expertise in districts and communities are leveraged to maximize impact. Voluntary counseling testing, they say, is an entry point to HIV prevention, treatment, care and support services. This project recognizes the important role voluntary counseling testing plays, hence has combined it at the health facilities as well as mobile voluntary counseling testing services to hard-to-reach and underserved communities. Opinion leaders, community elders and chiefs are the first point of call in every community they visit.
Amen. Nana what's a habako and a pay Mudaba for him.
That's it. And that chap, a charming Pochamontanana. Your bag come him be by HIV is education. About they were had there. In the Ababashon of whom Jim will crew me her. Near brother and fear bitchanana. Near Bassanana. And Sunny to me, I shall say.
Obey no would be. When not quite a subject was on ever. And see what over you. Obey one first no iron. No, I want to agree. The mushrooms maybe. You, Nandi, Madame. Or they hear the Yabua with no codo.
This is very important for a successful program, and it has enabled field teams to organize successful programs with a massive uptake of mobile voluntary counseling testing services. The various educational activities that local NGOs undertake is complemented by mass media education through the use of local FM stations who broadcast HIV educational programs to the catchment communities covered by the project.
The program was about 3 months and I've learned a lot from it. So now I have been teaching a lot of people about what AIDS is, about the misconceptions people have about AIDS. Now a lot of people sometimes call me to even get some help and have been trying to help them with some advice because I got a lot of things from the personnel who came. At different doctors, about 5 or 7 different doctors from different locations, from Fianquanta, Port, and other places came. So I've been able to accumulate the experience from all these 7 doctors. So I'm now probably, I don't know if I can call myself a consultant because I've been able to gather the bits and pieces from all these doctors. I hope I have learned a lot and I have changed my perceptions about some things I knew about HIV. I'm calling on others to also change their perception about HIV.
From the beginning of the project, stigma was the first focus. We needed to desensitize people about issues of stigma.
Clients who test positive either through the mobile voluntary counseling testing program or the health facilities are enrolled into treatment services in sites that are close to them. The project has engaged 8 private and company-based clinics and hospitals in the central and western regions to provide various HIV services. The Ghana Post and Harbours Authority Hospital at Takoradi and the AB Hospital at Takra provides comprehensive HIV services, including counseling and testing, prevention of mother-to-child transmission, treatment of opportunistic infections, and the provision of antiretroviral therapy to manage HIV patients.
Okay.
The Trifo Oil Palm Plantation Clinic and the Benzo Oil Palm Plantation Clinic provides counseling and testing services, prevention of mother-to-child transmission services, treatment of opportunistic infections, while the Sam Jonah Clinic at Idweprim, St. John's Clinic at Cape Coast, Tamohe Clinic at Takwa, and the Nsuta Magennis Hospital provides counseling and testing services. A client who tests positive either at the mobile voluntary counseling and testing service or at the clinic or hospital undergoes basic laboratory investigations. The patient is then referred to a physician who determines the type of treatment best for the client based on results from the lab investigations. But before the patient starts his or her medication, there is always adherence counseling by a pharmacist.
Adherence counseling is a counseling session through which we take HIV positive patients who are eligible for treatment. And it's a whole long process. If I say a whole long process, I don't mean it's one long session, but it's a continuous thing. You know, it's not a one-day thing. And we take them through this counseling just to let them to have a good idea of what HIV is all about. Also to talk to them about their antiretroviral drugs, the dosing, the side effects, and any information they have to know about their antiretroviral drugs. Now, this is very important because if you are going to be put on antiretroviral drugs, you have to know quite enough about these drugs. Otherwise, the drugs could be very harmful to you. You know, drugs generally are said to be potential poisons, and HIV drugs are no exception. These are very strong drugs. So if the patient doesn't know much about these drugs, the drugs could even turn out to harm the patient instead of being a benefit to the patient. And adherence counseling is done with what we call an adherence monitor. You know, the patient or the client comes in with a monitor, and the monitor is supposed to help the clients to go through the adherence or to go through antiretroviral therapy.
Clients are referred to support groups to be taught and encouraged how to live positively with HIV through counseling and regular home visits.
Na yeben beda no wedi no ade no starting day anansi no kwai na mpompo started the obobo ntinemu no na hospital na mede yede ne medoko ntoma mukata mebusuafo nchen ntimba mefi mebusuafo nchen na meba mennuano menchen no ansana mebekọ hospital mwaka chim da madi na oho sisi amugudi ya menu ho kese ebi oho owesi chire yelba ebi oho so a owo mbodiambrodo nusu ho na abi na wonume eduru de bia today hen so yenye HIV the man hen so yenumi heduru abibia edu yenuma kasi afubo denti na ho na wenya akuma yelba anesi chire yelba no waka ho mfua na ihe na yenye HIV no wontum yenka hen emfehemfua.
Generally, I would advise my fellow citizens out there that it is very, very important to take advantage of the VCTs. It is better to know your status, where you stand. Are you positive? Are you negative? That helps you to live your life.
If you take the mobile team, for example, if within a period of 8 months they were able to counsel over 10,000 people for them to accept testing, and out of this over 400 were found to be reactive, then there's the need to expand this further to other parts of the region, and also to improve on our prevention of mother-to-child transmission. We will continue to use whatever has been done and even improve it further and get better results for the people of the Western region.
There have been a few challenges on the field. One of them is such that some of the communities are very remote, and the roads that lead to such communities are sometimes on more trouble. But HIV has no respect for anybody. Whether you are in the village or you are in the hamlet or cottage, HIV, once the virus enters that community, it is going to thrive in that community. And therefore, we believe that although we've had such challenges like poor road network, we believe in future we may get vehicles and other equipment that will, improve access to those communities. We do know that drugs are currently available for pregnant women who are HIV positive, so that when a pregnant woman gets tested and the pregnant woman is positive, doctors can help that pregnant woman to prevent the virus from being transmitted to the unborn child. And we think this has been a very good thing for us on the field, because in the remote areas, some pregnant women got access to knowing their HIV status through the mobile voluntary testing and counseling. Those who were positive were referred into care, and they are being taken care of by the hospitals where they went for treatment.
The good thing about all this is that we have only a small fraction of the Ghanaian population that are infected with HIV. The bigger majority of us, over 97% of us, are HIV negative. But the issue is that we cannot leave those who are infected in the cold, and we need to reach out to people who are infected.